Hi, I'm Dr. Epstein. I have a patient here we're doing a couple of procedures on her, but I'm going to talk about how I approach eyelid surgery, upper eyelid blepharoplasty. I'm going to go ahead and show how I mark it out. She's relatively young, very pretty. She's got nice thick skin due to her Hispanic ethnicity. But her main issues, can you hold this for me, Jackie, is that she feels her eyelids are quite heavy. She's got that on both sides. It also appears relatively symmetric. In addition, go ahead and shut your eyes for me, Adrian. When I push down, you see that excess fat. This is the fat that we're going to want to remove. Out here, there's not any fat. This is just the lacrimal gland, which you want to leave, just some thick muscle. And then this is the excess skin that we want to go ahead and excise along with the excess fat. So the way I go ahead and I do this is I first want to go ahead and, it's so important that the patient's sitting upright. You want to make sure that they're not utilizing their forehead muscles to hold the eyebrows up, because once you go ahead and after the skin's been removed, they're no longer going to need to use their forehead muscles to hold up the eyebrows, and then they're going to droop. That's not her situation. In her case, she doesn't utilize her forehead muscles, which is nice. But anyway, she's sitting up, and what I'm going to do is I'm going to have her first shut her eye, and I'm going to have her slowly open. Go ahead, Adriana, slowly open and shut. Shut again. Slowly open and close. So now I've gone ahead. Shut your eyes again, sweet. Good. I've identified where the superior tarsal crease is. Now note that I already indicated that her eyelids are symmetric. But in cases where they're not symmetric, it's important that you do things to, that you plan your incisions so that they, keep your eyes shut, sweet. That you plan your incisions so you can make the superior tarsal crease more even. So I've gone ahead and I've marked the upper incision, the main portion of it. Take my marker and I go ahead and I dry the ink. Now I want you slowly open again, sweetie, and close. Good. Now this is the key. This is one of the key steps towards achieving a nice result, is how you go ahead and you go from the superior tarsal crease out laterally, and you'll see it's approximately 1 centimeter out and 1 centimeter up from the lateral canthus. And so that's the point where I go ahead and I suddenly go from within the tarsal crease to a more upward direction. Now some patients have a natural eyelid, a natural like crow's feet. She doesn't. Her skin's very smooth, but you can see I've gone in an upward direction. The reason why it's so important not to go down, but to go up, is so laterally when it heals, you get a little bit of a pull up, a little bit of a lift up, which looks really nice. Okay, let's go to the other side. Why don't you go ahead, sweet? And she really has very prominent creases, very easy to see. Shut your eye again, sweet. Open slowly and close. So once again, I'm marking out the line. Keep your eyes shut. And then, once again, approximately 1 centimeter, 1 centimeter, and then I head upwards in a superior tarsal, in a horizontal wrinkle, or what would be a wrinkle. Now I go ahead, I look at both sides, I hold her eyelids up, her eyebrows up, open up your eyes, and shut. So now I know that we've gone ahead and we're relatively symmetric. Now to determine, keep your eyes shut, the excess amount of skin that she has, is I go ahead, turn this way a little bit, keep your eyes shut. I'm holding up the eyebrows so I can go ahead and get my forceps. This is a suture removal forceps that we utilize. And I'm going ahead and I'm calculating how much skin I can remove without pulling up much on her eyelid, just underneath that amount. And then I go ahead and I see my incision, and I bring it across. I come around like this. And then in the inner canthal region, you want to make sure you don't go too far medial into this little crease there. And then I test to see if I've removed enough skin, and that's going to be just about enough. And I can always do a very slight adjustment, in fact, in her. Open your eyes again. Good. Shut your eyes. I'm going to go just a little higher, but not too much. She's got very thick skin. We don't want to go ahead and leave her too open. Good. Now we do the same thing with this side. Keep your eyes shut. And I'm grabbing that. Good. Once again, you don't want to go too far medially, because then towards the nose, because then you risk getting a web. Look straight ahead at me, open your eyes, and shut. Okay, good. And I'm going to make them more even. Look straight ahead at me, and shut. Okay. I want to come in just a little bit on this side, rather go a little bit conservatively, especially since I'm going to make a little note that I'm going to stay a little lower. Especially since once I take out the fat, you want to have enough skin for her skin to be able to contract back down so it doesn't tent over this area, so it doesn't close properly. So go ahead and open your eyes again. And look, we look relatively symmetric. I'm going to check one more time. Shut your eyes one more time. And then I'm going ahead and testing that. I'm going to take just a little bit more. And then I'm going to just make a little note. But this one I'm going to go more towards the top. Open up one more time. And shut. So there we've gone ahead. That's how we go ahead and mark out for upper eyelid surgery. This procedure is going to be done in her case under IV sedation, since we're going to be doing some other work on her. This is Dr. Epstein. Thank you very much.